We've all heard of weight bias, which refers to negative attitudes, beliefs, or assumptions about others based on their body weight or size. Now, weight bias can lead to weight stigma, or the disapproval or unequal treatment of someone based on their weight. But have you heard of food bias? This suggests that we make food decisions or judgments because we've somehow received the message that that food is better or worse for us, without the evidence. It's what makes us categorize foods as bad or good and feel equally good or bad about ourselves after eating them. Many of us, especially those who've grown up in traditional American homes, can wrongfully label ethnic foods as unhealthy, greasy, or low quality. Let me give you some examples. When you think of Chinese food, what comes to mind? Now, I think of fried rice, MSG, and breaded chicken covered in sticky sweet sauce. Now, what about Mexican food? Tacos, burritos, and cheese-covered nachos. Does that sound familiar? How about mochi? American brands have popularized this and turned a traditional chewy rice ball filled with bean paste into an ice cream-filled donut of sorts. Ethnic foods prepared traditionally may not be as unhealthy as they seem. And this is so important to remember when you are evaluating a person's diet and making suggestions or swaps to help manage their medical conditions. I'm Colleen Sloan, a PA, dietitian, and your nutrition mentor. Welcome to the Exam Room Nutrition Podcast, your guide to giving better nutrition advice. Join me for a fascinating and eye-opening discussion as we are invited to the table to evaluate the traditional Mexican culture and cuisine through the lens of kidney health. Now, if you've labeled Mexican food as greasy, unhealthy, or told your patient to stop eating it altogether, today's episode is going to challenge that thought, my friend. Even I had an uncomfortable learning moment today. Food is an amazing way to learn about other people, eat delicious meals, and increase the diversity of our diets. Meals don't have to be composed of the standard protein, vegetable, and carbohydrate at each sitting, even though in America we've been taught that a healthy or balanced plate should always follow this rubric. Now, this meal pattern may work for some, but it certainly does not fit for all cultures. But by understanding how your own misunderstanding or bias affects nutrition recommendations, you'll be better able to guide your patient to enjoy and appreciate their cultural foods without guilt. Allowing and celebrating foods that help your patient feel more connected to their roots and positive emotions and memories will be nourishing, regardless of how the food might be organized on the plate. Now, let me introduce you to my guest today. Areli Gutierrez is a bilingual Mexican-American registered dietitian. Currently, she works as a renal dietitian for DaVita Kidney Care. Areli is committed to improving cultural competency as well as practicing with cultural humility, and she discusses this topic with other healthcare professionals on her podcast, Food Culture Curious. She additionally presented at the 2023 Food and Nutrition Conference and Expo on cultural inclusivity in the renal diet for Latinos. By the end of this episode, you'll have a whole new perspective on Mexican cuisine, and you'll feel so much more confident helping patients make smart changes without feeling like they have to give up the foods they know and love. Let's get started. Well, hey there, Areli. I am so excited to chat with you. Welcome to the show.
Thank you so much for having me.
I want to start out kind of broad, and then we'll get into some specifics. But I love your background and your culture as a Mexican-American. Speak about the importance of cultural inclusion in our diet recommendations, and why is something like this important?
As you know, I specialize more than anything about cultural inclusion in the kidney space, but in a more general term, it's so important because no matter what niche you're in, I feel like overall the Mexican diet gets a lot of bad rep. So I've heard a lot of people say, Mexican food is so unhealthy. I'm trying to be healthy, so I'm trying to avoid Mexican food. And I talk about that on my podcast, how our traditional foods, our cultural foods are not unhealthy. And I think because you don't see a lot of vegetables on the sides or a lot of like salads in our traditional foods, people think that there's no vegetables in there, but they don't realize that everything that we make, all of our guisados, all of our dishes, the vegetables are in the food. It's kind of like a curry, right? Everything gets blended. And just because these vegetables are blended into our foods doesn't mean they no longer have their nutrition properties. It's just very important for the general public and especially healthcare professionals to realize that our traditional foods are not the issue.
How can we be more culturally sensitive when we're talking about what foods they eat or what foods maybe they should be eating? How can we use very sensitive language?
Yeah. So when you're doing the recall, right? And I think this is a little bit more for the dietitians, but when you're doing the recall, learning what they're already eating and teaching them about what foods they're having are already healthy, right? Like some people don't realize, like salsa, it's completely made out of vegetables. If you like salsa, put that on everything and you're adding more veggies to your meal. So validating what they're already eating and teaching them how to add more. We never want to take away from the patient. We always want to teach them how to enrich and how to add more. You like squash, you like carrots, let's name all the things that you do enjoy. How can we add more of that into your diet? And be familiar with the Mexican diet overall. Go to some Mexican meat markets, go to authentic, traditional Mexican restaurants so you can see what dishes that we have already are either vegetarian or very heavy in plants. And let's encourage more of those.
I love the what can we add approach as opposed to like listing all the things you can't have because no one likes to hear that. It's really disheartening to hear just this massive list of foods you can never eat. So it's such a better approach. And I love that you take that approach to just educate them on like, let's look at all of the things that you can enjoy and let's focus on that. So I love that.
Wow.
Now let's get into the kidney and some myths around foods that patients can or can't have.
Yeah, absolutely. So there's very few Hispanic dietitians and even less in the kidney space. So when I first came in, I would talk to patients and they would be in tears, right? My Hispanic patients in tears because the nephrologist or the nurse or someone would tell them, oh, you have a high potassium. You can't have tomatoes. You can't have mangoes. You can't have potatoes. You have a high phosphorus. You can't eat beans, and then just taking away all of their cultural foods. And the more and more I learned about the reasons for a high phosphorus or a high potassium, a lot of the times it's not the diet that's causing the issue, right? Focusing just on dialysis, they could be having issues with their access. They could be formerly on a potassium wasting medication and now they're on a potassium sparing medication. They could be taking omeprazole or another medication that's made with phosphorus. So there's all these other sources of potassium and phosphorus that we need to be aware of and that we need to rule out before we even approach the diet. And if anything, what the studies are showing is that the patients that eat the most fruits and vegetables are the ones that are going to have the least problems with potassium and phosphorus because they're not going to be constipated. They're not going to have all of these issues, especially cardiovascular issues that happen when we're restricting fruits and vegetables. So that's the biggest thing. If I do nothing else in my life, I want to educate healthcare professionals about not taking away, especially fruits and vegetables, which makes up a lot of our cultural foods.
That's such a good point. And it really is patient specific, right? You do really have to look at those labs to determine, okay, if you love foods that tend to be higher in potassium, can we maybe allow you to have half of a tomato? Working with them. And this is where I think working with a dietitian, especially with kidney patients, is so crucial because just telling patients no beans, no bananas, and no potatoes, that is so limiting and can be so frustrating and difficult for patients. Now, we're not going to get into the, basics of exactly what a kidney diet is because I've done that. If you guys want to go back to episode 43, it's called Nutrition and Kidney Disease. What is a renal diet? If you wanted to just do a quick refresher on the components of what a renal or kidney diet actually is. But I want to linger here with potassium and phosphorus because these are the two nutrients that people get so confused on. And guidelines have changed too. So if it's been a while since you've been in school, you might have been taught one thing, but it has completely changed. So first and foremost, talk to us about each of these different nutrients and some of the high sources that we might find in a traditional Mexican diet.
Like you mentioned, the guidelines changed, right, prior to the 2020 update. They were really focusing on those lists of avoiding the high potassium fruits and vegetables, all of that. Now, the new guidelines encourage that we have them, right, especially if there's no need for a phosphorus or potassium restriction. And then another update that happened that's very important is making sure that we're avoiding, if we're going to avoid and restrict focusing on those phosphorus and potassium additives, right? Making sure we're teaching the patients about how to read their labels so they can take out some of these phosphorus and potassium additives. And that, more than anything, is what's really going to help the patient. Being specific to like the traditional Mexican diet, for example, if we're talking about those additives, soda is very prominent. Traditionally, I think that's Coke has a really big influence in Mexico, just like the brand Coca-Cola has a big influence. Teaching them about which sodas are lower in phosphorus and talking about, for example, Mexican hot chocolate, right? There's two very prominent brands in Mexico. There's the Chocolate Abuelita, Chocolate Barra. But if you look at the label, one of them has both phosphorus and potassium additives, and the other one doesn't. So again, like these cultural foods, with just making sure that they know how to read the labels and avoid those phosphorus and potassium additives. We also tend to have, dairy in our diet. So talking to them about the new guidelines that one serving of dairy a day is okay, and making sure that we're combining, if we are going to have that one high phosphorus food, to pair it with the lower phosphorus or lower potassium additives. Also talking to them about, like, we do eat a lot of beans, and this is, again, great. If the phosphorus is coming from a plant-based source, you're only absorbing half of it or less than half. So if we're going to get phosphorus from anywhere, it's better to get it from a plant. But talking about how to cook food so that we leach out, especially the potassium. So if we're double boiling potatoes, double boiling beans, we can leach out some of the potassium and be able to include it safely in the diet a little bit better.
Now I want to linger here with the additives, because I think that is probably one of the biggest guidelines that a lot of clinicians, if you're not in nephrology, probably aren't aware of, because it's just like you had said, that's really what we're worrying about, not naturally high phosphorus foods, but the phosphorus additives. So Can you educate my listeners on what that is and what they should look for and how they can instruct their patients to find that on the label?
So food manufacturers and even, medication, drug manufacturers, they use phosphorus and potassium additives for many different reasons. That could be for help with emulsification. It could be to promote shelf life. A lot of different reasons these additives are being added. But what happens is that the body absorbs about 90 to 100% of these additives compared to animal and plant sources. So in order to find them, if you're familiar with the nutrition label, they're not going to be anywhere in the top box, right? They're going to be underneath in the ingredients, and they come in many different names, but you have to look for that phos and you have to look for that potassium. So triphosphate. But if the phos is in there and the potassium is in there, that's an additive that's going to be highly absorbed.
And for food that has those ingredients, should that be like always avoided, or is it sort of like a proceed with caution food?
I would say proceed with caution, because it's going to be very difficult to completely avoid it. As much as we can, we're going to promote more home cooked foods, like that are made from scratch, because this is the best way to avoid those additives. But we also have to be realistic with our patients. Some of them, they're still working. Some of them are younger patients that have families and are busy just like us. And we have to be realistic when we're making these recommendations that, okay, we've identified that there's this one higher phosphorus food, in additives. What can we pair it with to make sure that we can reduce the overall phosphorus or potassium in the meal?
Now, when you say pairing, are we just trying to pair it with any other food just so the body kind of slows down the absorption rate of that? Or are there specific other nutrients that kind of offset it, just like sodium, potassium, or kind of that nice balance? Specifically for phosphorus, what foods are we looking to pair it with?
Yeah, unfortunately, it's not like in diabetes where if you pair a carb with protein, it's going to slow it down. There's anything in particular that's going to slow down absorption unless you're taking a binder, right? The medication. So more than anything, just displacing having too many sources that are high in potassium or high in phosphorus with lower phosphorus or potassium sources.
Awesome. And that actually segues us really nicely into my next question, which is, what are some of those lower potassium foods that maybe people in the Mexican culture can enjoy?
The more I learn, the more I realize what foods are higher in potassium, what foods are lower in potassium. But it also depends on the portion. So I can't even say like, okay, this one food is safe, right? Because it could be for half a cup, it's lower in potassium. But if you're having 2-3 cups of it, it's no longer low potassium. Even when I was thinking like calabazas or squash, like that's a higher potassium food. It's like it's recipe specific for how you have to modify it,
Yeah, no,
if
and I
that
think
makes
this
sense.
is really no, this is so helpful because nutrition isn't black and white, and that's why giving suggestions is really, really hard. But I love where you went with the portion size because in my mind, I kind of think of the opposite. Like, okay, a tomato, because that's it. Everyone knows that's high in potassium. We don't always have to avoid it. Maybe they really can handle a handful of the, cherry tomatoes versus 3 whole tomatoes every day. And that's fine because now they're still able to enjoy it. But on your end of things, if people are overeating low potassium foods, it now turns it into a high potassium food. So that's really, really interesting. Now, as a kidney dietitian, what exactly do you look at to determine if we can liberalize their diet or not? Like, what are you looking for?
We're always looking at trends. We're always looking overall, especially thankfully, at least in the dialysis space, we're looking at labs monthly, sometimes even more often than that. So we can see if the potassium is trending up. Again, first, making sure we're addressing any other reason they could have a high potassium. But when we're talking about the diet, focusing, like you said, on the portion, the concentration, right? It's not the same a cherry tomato versus a cup of salsa or a cup of spaghetti sauce. So we want to talk to them about those different portion sizes. And depending how many higher potassium or higher phosphorus foods they're having in the diet, giving them that rule of thumb, right? So letting them know, similar to how we can have around 2,000 milligrams of sodium in a sodium restricted diet, potassium restricted is the same thing, right? 2,000 milligrams a day. So that's going to mean around 600 per meal, 1 to 200 per snack. So talking with them, like, what do you put on your tacos? What do you put on your tostadas? And if you're having multiple sources of high potassium items, like how can we portion that so that it stays within that 600 milligram, rule of thumb?
I think that's really, really helpful because breaking it up into meals and snacks, especially with potassium, because that is something that they can track that's on the food labels. That's something that they can
Mm-hmm.
actually calculate, or you can sit down and calculate with them. But I think that's really helpful to kind of give them meal set guidelines because maybe they have no potassium during breakfast. So that does liberalize lunch or dinner options to where that they can still have foods that they enjoy. Now, I'm curious about another nutrient in the kidney diet that we talk a lot about, and that's protein. Is this an area of concern for the Mexican culture? Do they get enough protein, too much protein? Curious your thoughts on that.
I want to say in the traditional diet, especially in modern times, we are very protein heavy. We are very meat heavy. I think we've entered an era where, and I've heard this a lot from my patients, where if meat isn't present at the meal, it's not a meal, right? That's just obviously that's not how things were in the past. Before Mexico was colonized, we were pretty much eating mainly vegetarian meals, but now modern day, I feel like it is very meat heavy. So that can be a concern if they're not on dialysis yet and they're still trying to preserve that kidney function. Having a very protein heavy meal would be a detriment. But when you're on dialysis and you're losing so much protein, that extra protein is actually helpful to them. So it depends where they are on their journey.
Yeah, that's a really good point. Now, this doesn't necessarily relate to kidneys, but I'm curious about the amount of fat in a traditional Mexican diet. In my mind, and I would love for you to correct me if I'm wrong, but I think of tortillas and tacos and nachos, tostadas. Those are all traditionally fried and correct. So is their diet tend to be higher in fat or am I wrong there?
Yeah. And it just depends what you've been exposed to, right? So if you consider, like, if you go into a Tex Mex restaurant, like you mentioned nachos, right? Like nachos isn't really an authentic Mexican food. I never saw that at home growing up, right? So it's what are we thinking is the traditional Mexican food if your only exposure to traditional Mexican food is going to a restaurant? Anytime you're in a restaurant, you're always going to see the heavier, tastier items, right? Same as when we go to an Italian restaurant or any type of restaurant, they're going to bring you the things that are more satisfying, that's going to get the restaurant the most money. That's not necessarily the way people cook at home, right? When we're doing our home cooking, we cook with a lot of vegetables. Yes, some things are pan fried, but at least in my house, we always used a lot of canola oil. Like we used the only time I ever really saw us using a lot of lard was if we're making tamales. So overall, I feel like the amount of fat, it's always going to depend on portion, right? It could be heavier, of course, if you're having like 7 tacos versus like 3, but it's still going to be part of a healthy diet if you're still adding in those other traditional foods.
No, I love this conversation because this is like the exact point of why I wanted to talk to you because, just look for me as an example. I am an American. I grew up in America. In my mind, nachos are a Mexican-ish dish because they're at all of our Tex-Mex type restaurants, right? When I think of Chili's, I think of Taco Bell, right? Now,
Yeah.
obviously, I know these are not traditional Mexican restaurants, but I love that because if you kind of think on yourself and just do an internal check, if those are the foods that you're thinking about when you're working with maybe a Mexican patient, those aren't always the foods that they're eating. A
Yeah.
home cooked tortilla is very different than in your mind, the nachos that you think that a Mexican is eating, right? So I love the cultural sensitivity and that we're bringing it back to kind of where we started, that just be aware of what your interpretations are and what your preconceived ideas are about a culture and use it to be curious. That's where that diet recall. And yes, although dietitians are really great at that and should be doing it, in my opinion, providers should be doing a diet recall as well. We have the time, you have a few minutes. It does not take that much time to at least get an idea of what they're eating. Because, like you said, traditional Mexican foods, if they're cooked from home, are actually quite healthy and quite
Right.
nutrient dense. And so they might not even have to avoid any of those foods. So I love this conversation and how much it opens your eyes to what you think about a culture and how you may be wrong.
I remember when I was in college, they were talking about Mexican food in my dietetics class, and they were talking about, yellow cheese and like all these. And I'm like, what do you mean? Like, we don't put yellow cheese on anything. That's not a Mexican thing.
That's so interesting. Yeah. I mean, and it's also marketing and like labeling, like even
Mhm.
shredded cheese. Now some of those brands call it like Mexican cheese for tacos or whatever, and like you said, like, that's not even a Mexican thing. So to label it like that, it just causes even more cultural confusion, I think there. I think that's so funny that you talk about how in your dietetic class, they were talking about Mexican food and that cheese wasn't even Mexican. So tell me about some other foods that you use or even like toppings that you use. Like sour cream, right, is a very American thing to put on tacos. I don't think
Right.
Mexicans use it. So let me know, like, what are some cultural toppings, cheeses, and different things that are actually Mexican that,
Yeah.
Americans don't know about?
So many, so many. We could talk a whole hour about that. And especially, depending the region you're from, it's going to be different, right? Some regions of Mexico, they like to use more queso fresco. Some regions are like Oaxaca. Oaxaca cheese comes from Oaxaca. So they have like different types of cheese depending where you are. And then same thing with tortillas. Like if you get more into central southern Mexico, you're going to see more corn tortillas, but northern Mexico, you can see more flour tortillas. So there's a lot of regional differences as to what is, a traditional Mexican food. But just like the US, LA doesn't eat the same things as New York. Everyone's going to have their regional differences. Every Mexican is different. And even things that are like traditional Mexican foods, your patient might not necessarily eat those foods, right? So it's important to be culturally aware and learn more, but to never assume, especially just because a patient is of Mexican descent, they could be second or third generation and not even really eat a lot of traditional foods. So always start from zero and ask.
No, I love that. Now, I want to shift a little bit here. I know that diabetes is a huge risk factor for kidney disease, and
Mhm.
I don't know the statistics, but I do believe that diabetes is pretty prevalent in the Mexican culture, and overweight and obesity tend to be as well. So, what are some strategies that the clinician can do to help prevent, kidney disease and kidney injury from happening, especially for those who may already be diabetic or are already struggling with their weight? What are some specific dietary interventions that they can suggest?
Yeah, I would definitely say refer, refer. It is so important to see a dietitian, especially in those early stages, and even better if they can find one that's culturally sensitive or of their similar background, because there's so many nuances that have to be taken into consideration when you're creating these meal plans and these early interventions, especially teaching them, how to pair when you're talking about diabetes, how to pair that rice with fats, how to pair it with protein so that we can control those blood sugars. But more than anything, making sure that they have access. I think that's the hardest part for the Mexican or Hispanic population, is that we don't have a lot of access to the things that could help the progression, right? There's so many issues, especially the patients that are lower income, with having access to medications, having access to the doctor, having access to a dietitian. Like, I definitely don't think it's the food that's causing the rise in diabetes among the Hispanic population. I feel there's a lot of barriers that prevent us from getting the help that we need, the social determinants of health, right, that impede that. But when you're working with what you have with the patient in front of you, refer so that the dietitian can teach them how to pair their cultural foods in a way that balances those blood sugars.
What do you think a good step would be to maybe talk to them about soda? If you like you mentioned in the beginning, like Coca-Cola is like a really popular beverage. Would that be like a great, kind of first step intervention as they're maybe waiting for the dietitian? Or are there other things that we could suggest that maybe they minimize or decrease in their diet to help with that as kind of we're getting them into the dietitian store?
Doing the dietary recall, right? Never assuming. And if they do mention soda, yeah, you can mention to them, okay, well, maybe let's consider some of the time either doing something that's lower in sugar, like a diet soda, or something that they might be amenable to, right? Like, how do you feel about aguas frescas, right? How can we make that with a sweetener instead of sugar? So there's definitely different approaches you can take, but it all comes from where that patient is right now and what foods they already include in that diet. And like I mentioned, after you do your recall, go through the foods, celebrate the things that they're already doing well, right? And teach them how to add more nutrition to displace those heavier items that might be causing some issues.
That's a really valuable point. Now, I wanted to close with a big topic, but a final nutrient that really affects kidneys a lot, and that's sodium. And we
Mhm.
know that we've got to minimize salt intake. I know in the United States, our sodium intake is just sky high through the roof, especially if you're eating out, and the majority of us do. It is just the way that it is. But
Mhm.
is sodium a concern for the Mexican population? And if so, what are some foods that we can suggest that they eat again to protect their kidney?
I think teaching them about the seasonings, right? Because whenever we're using, vegetables as seasoning, herbs as seasoning, that's not adding to the sodium, but it is increasing flavor. So teaching them how to use those herbs, how to use those seasonings that don't have salt. And then also making them aware about, I don't think a lot of people realize that things like lemon pepper or chicken bouillon, all of those are very heavy and prominently salt, because they do have a lot of flavor, but I don't think a lot of people realize this is more than anything, this is salt. So you have to consider it. I get a lot of patients that say, I never add salt to my foods. I never put table salt on my foods. I never use a salt shaker, but they don't realize that the chicken bouillon that they're using in the marinades is very heavy in salt. So teaching them how to make their own, like giving them a recipe for, okay, well, we're going to do garlic and onion and this and that, so that it kind of tastes like, chicken bouillon, teaching them how to make a chicken stock. And so that they don't have to use like chicken bouillon, they can just use a homemade chicken stock, can be very helpful. And also to be careful about suggesting low sodium items. Because unfortunately, if they're on dialysis, low sodium items are made with potassium chloride. So we don't want to be having this extra potassium additive because we're trying to avoid sodium. So again, focusing more than anything, flavoring with herbs, vegetables, homemade chicken stock, but the low sodium items, unfortunately, is not a good use if they're on a potassium restriction.
I think that's such a good point. And again, it shows how nuanced nutrition is, and that we do have to be really careful with our recommendations. That as the provider, you think like, oh, I'm giving some helpful advice by suggesting choosing low sodium, low salt options, but you're actually doing more
Mhm.
harm than good. So I always love closing this conversation with encouraging clinicians to refer to a dietitian, because as you can see, it's complicated, right? Like working with patients is tough, and it really is and does need to be personalized with that patient. And that's where dietitians come in. And you guys are just so skilled in that area. Areli, this has been so helpful. I would love for you to share where people can hang out with you on socials and just learn more from you and about you.
Thank you. Thank you. So I have a couple of Instagrams. One of them is Latina Kidney Dietitian, specifically for my kidney population. And then I have Food Culture Curious, which again is trying to reach healthcare professionals. I have dietitians, SLPs, social workers, culinary professionals come on the show and talk about their cultural foods and how to be culturally inclusive in different spaces of health and nutrition.
Oh, I love that. Now, is that your podcast, the name?
Food Culture Curious, yeah.
Food Culture Curious. Awesome. Well, I'm going to link down to all of those in the show notes. This has been so helpful. I have learned so much about cultural inclusivity and respect, and just I have enormous respect for you and the space that you're in. Thank you for sharing this with the world, and I really hope that others can learn from you as well too. So thanks for your time today.
Thank you so much for having me.
Now it's time for my nutrition notes. So I want to leave you with 5 reflection questions to help you recognize how your own cultural lens may shape the way that you provide care. Number 1, do you assume that certain diets are healthier than others based on your own cultural norms? Number 2, how has your upbringing or culture influenced your beliefs around food and eating practices? Number 3, have you ever labeled a patient's food preferences as unhealthy or junk without fully understanding their cultural significance? Number 4, how often do you suggest dietary changes that align with your own habits or culture rather than exploring what is realistic for your patient? And number 5, how can you ensure your nutrition advice includes flexibility for different cultural practices and food accessibility? So as you reflect on these questions, remember that awareness is the first step toward change. By acknowledging our own biases, we can offer more compassionate, personalized, and respectful nutrition advice. It's not just about recommending the healthiest options, but understanding how culture, tradition, and identity shapes our patients' food choices. The goal should always be to empower your patients to make informed decisions that fit within their lives, while ensuring you're respecting their background and traditions. When we approach nutrition advice with cultural sensitivity, we're not just helping our patients make better choices, we're building trust, connection, and lasting health outcomes. I hope this episode was helpful, my friend, and let's continue to make our patients healthier, one exam room at a time. I'll see you next time.